according to our letter, attending this press conference. We call this press conference to introduce this project. It's actually the third such conference that is being held. The first one was held at St. John's, when we also had about 6 press who showed up for that. Now, the project we would like to explain to you is given in the sheet handed out to you. This is a cycling project, transnational cycling tour called Le Tour de l'Earth, which is going from Penang to Xiamen or Amoy in China. This project was conceived by our friend YB, Yang Muhammad Tei Chiu, about late last year. It was his personal project, and he approached a number of people, including Dr. Sri, Dr. Wee from St. John's and Family Planning Association, to explain the purpose of this project he wanted to undertake. The gist is that he had a personal interest. He ambitioned to be able to do a long distance cycling tour from Penang, he suggests, to Xiamen, and attached to it he wanted to do some charitable work. So he wanted to do it as a campaign to raise money to help 5 organizations, which are St. John's Ambulance, Family Planning Association, National Cancer Society, the Hospice Group, and 2 educational groups which are mentioned in this pamphlet, Tamil Foundation and the Persatuan Pendidikan Tuchong Pulau Pinang. The different groups who were going to benefit from this thought it was a very good idea and agreed to the whole project. And they had the first meeting, which was chaired at St. John's Ambulance by Dr. Yi, who is the State Commissioner for the St. John's. And the committee then decided on work to be undertaken, and the beneficiaries were to take part, to contribute as much as they could. At that first meeting, I did bring the apologies that National Cancer Society of Malaysia Penang branch this year is very involved in, at that time we were very involved with the Relay for Life program, which was taking part in March. So we didn't have the staff to spare to help out anything. And following this, we also have now coming up 40th anniversary of the NCSM Penang is celebrating its 40th anniversary this year. We're organizing another event there. On top of that, we are also organizing a congress, a hospice congress on behalf of Malaysian Hospice Council. So because of that, the committee agreed that we will take part, but will not be as active as the other groups. So it's now actually a lot of work has been put in by St. John's and the Family Planning Association also. St. John's acting as secretariat and the FPA acting as the center to coordinate the collection of donations, financial sponsors, and so on. So that's how the project stands at this moment. Originally, as you see, the project at first conceived was as a sporting event, sporting and social event to promote cycling, healthy living, and things like that, and social in terms of the support, fundraising to support the NGOs involved in doing social work for the community. But of course, at that stage, we didn't know, at least the committee didn't know that YB was standing for elections. And as it turned out, he is now in the State Assembly. So it's added on a new dimension to the project in terms that the state government, I think, is interested to support this project. We had at a joint conference the EXCO for Sports and Youth Activities, who said the state government was going to support the project. And so it is taking on the new dimension that this has has got the state government support, and for that matter, YB, when he cycles through all these different countries, will be acting in a way as an ambassador, a diplomatic ambassador. He could be maybe carrying messages from the government to these other centers like Bangkok, Hanoi, Phnom Penh, those countries he's passing through. And then Xiamen, incidentally, is a sister city of Penang, Georgetown. So he could be carrying messages across, on promoting Penang as a tourism destination, including investment destination, or whatever the message the state government wants to pass over to their corresponding counterpart in those places. So it has added a new dimension, and it is worthwhile to promote this. So we want your help to publicize this so that the public will understand what the project is about and is worthy of support. And the intention was YB will be leaving, cycling off on the 10th of May. It's still on the 10th of May. The trip will take about 50 days. He should arrive in Xiamen sometime early July, and then they will fly back from Xiamen straight to Penang, back in time for the opening of the State Assembly. I think that's what he wants to be around for. Incidentally, originally YB Tay was going to be accompanied by Mr. Errol here as a navigator, but this morning YB told me that he is going to have a third person joining them, another cyclist, which is Sam here. He is also a Penangite, but came up from Singapore, who he originally intended to cycle from Singapore to Beijing. So he cycled up from Singapore last week and arrived in Penang, then found out about this project from Penang to Xiamen. So he's going to join them on the trip between Penang to Xiamen, and after, when they arrive at Xiamen, he will then proceed on his own, cycling up to Beijing. So now there will be 3 people on the trip, an additional companion for the Errol and YBT.
As you have already heard, we are one of the recipients for the funds that are raised by this, can I call it, adventure. And so perhaps you'd want to know a little bit about who we are. And the information is given on this sheet in your file itself. Basically, we are a cancer society. We are the Penang branch of the National Cancer Society of Malaysia, which was set up in 1966 in Kuala Lumpur. We were established in 1968, so this year happens to be our 40th anniversary, and that's why Dr. Wu mentioned that in July we will be celebrating 40th year of existence. As a cancer society, our main aims are to try and see how we can reduce the burden of cancer in the community. So we provide information about cancer through provision of pamphlets, through provision of exhibitions. We also have early detection services. Currently, it is only dealing with mammography, special X-rays of the breast to detect breast cancer, and also what we call patient support services, which is basically what comes under our programs called Hospice at Home program and our Rumah Hospice, which is an 8-bedded hospital that is downstairs. So our Hospice at Home, our mammography service itself started in 1989. We were the first NGO to have the service in Penang way back in 1989. And we also had, previous to that, from the time we started in 1968, a pap smear service to detect early cancer of the cervix. But due to staff constraints, that was stopped about 4 or 5 years ago. Now, the Hospice at Home program itself began in 1992, and up to date, up to the end of last year, we have had about 4,700 people entering our program.